Dyspepsia is another word for indigestion. People with chronic indigestion often report feelings of stomach pain, overfullness and bloating during and after eating. Other common symptoms include acid reflux, heartburn and excessive burping. These symptoms resemble peptic ulcer disease, but when tested, only 1/3 of the people will have a stomach ulcer. The other 2/3 will have functional dyspepsia. A functional dyspepsia is an ongoing problem with your bodily functions that can't be explained by any physical causes. Dyspepsia symptoms are sporadic. They come and go without any clear reasons, and it's hard to tell if anything in particular makes them better or worse. While functional dyspepsia is chronic, ongoing over a long period of time, it may disappear for a while and then return for unknown reasons. To be diagnosed, one must have had symptoms within the last 3 months and persistently for at least 6 months. Now one can experience epigastric pain. This is the pain in the upper part of the abdomen under just the rib cage. Bloated stomach, feelings of uncomfortable pressure or fullness especially after eating. Early satiety or loss of appetite, feeling of fullness very quickly just after or during eating. Heartburn, burning pain in the region between the stomach and the esophagus, usually due to the acid reflux. Acid reflux, acid comes up from your stomach through your esophagus, leading to a burning sensation, often a sour taste in your mouth. Nausea and vomiting. In severe cases, fullness and loss of appetite may develop into actual nausea or vomiting. Now let's discuss different types of functional dyspepsia. There are two types mainly: epigastric pain syndrome (EPS), which refers to only those symptoms which are associated with upper abdominal pain and burning sensation. Then postprandial distress syndrome (PPDS), refers to only those symptoms that occur after eating, such as early fullness, bloating and nausea. Gastritis and dyspepsia share many symptoms. Gastritis, which is inflammation of the stomach lining, usually has a traceable cause. It might be a bacterial infection, overuse of certain pain medications that erode the stomach lining, acids, or too much stomach acid. These things can be tested for and treated. If you have functional dyspepsia, gastritis may be the part of the equation. One can get the treatment for the cause of gastritis and experience some relief from those symptoms, but not total relief. GERD or GERD can also be a factor in functional dyspepsia. Heartburn, belching and the sour taste that sometimes comes with acid reflux are all among the symptoms of functional dyspepsia. Chronic acid reflux does visible damage to the esophagus over time. GERD is also relatively easy to treat with medications that reduce the stomach acid. Now IBS, that is irritable bowel syndrome, is another functional disorder like functional dyspepsia. They even have similar nicknames. Functional dyspepsia has been called irritable stomach syndrome and IBS has been termed as nervous stomach. However, IBS is really concerned with the bowels, especially the large intestine or colon. Functional dyspepsia symptoms are more involved with the stomach and the upper small intestine. Functional dyspepsia pain is more of a burning sensation in the upper GI tract, while IBS pain is more like cramping in the bowels due to constipation or diarrhea. Now what causes functional dyspepsia? Impaired stomach accommodation or emptying. Normally the stomach is supposed to relax and expand to accommodate food, but in some people this function might be impaired, leading to a constant full feeling. The signals that tell your stomach to empty food into your small intestine may also be impaired. This is termed as gastroparesis. This can cause food to back up, gas to build up and bacteria to breed too much while food sits too long in your tummy. Food allergies. If one has an undiagnosed food allergy, it could be producing an inflammatory response in the gut. Some people with functional dyspepsia have higher WBC counts, that is white blood counts, which suggests the gut immune system is activated. Some also self-report food sensitivities, particularly to the wheat. H. pylori infection. This common bacterial infection can cause chronic inflammation, gastritis in some people, as well as erode the mucous lining that protects the stomach against the gastric acid. Some people with functional dyspepsia to improve after getting treatment for H. pylori, that is Helicobacter pylori. Now visceral hypersensitivity. Some people's nervous systems are extra sensitive. These people might have a physical response to stress and emotional factors such as tightening and restriction of the digestive organs. Some of these people may also have visceral hypersensitivity, which means that regular expansion and contraction of the digestive organs feel excessive or uncomfortable to them. Also, one can have a functional GI dyspepsia if one does have a history of anxiety or depression, have a history of abuse, maybe emotional or sexual abuse during the childhood, have a history of H. pylori infection, use acids such as brufen, diclofenac sodium, smoke, or using the tobacco products. Now, how is functional dyspepsia diagnosed? Certain tests needed to diagnose, such as blood tests to check for common infectious diseases that might explain the symptoms, upper GI endoscopy and imaging tests to look inside organs for any structural problems. Now, blood tests to screen for abnormal bacteria in the gut. The urea blood test can detect H. pylori infection, while the hydrogen blood test can detect SIBO, small intestinal bacterial overgrowth. Now, gastric emptying studies to see how fast stomach empties into your small intestine. If there is no evidence of structural or biochemical disease and symptoms have been persistent for 3 months or more, one shall be diagnosed with functional dyspepsia. Now, how do you treat functional dyspepsia? That's very important. Acid reduction. Short-term course of medication to repress or neutralize the stomach acid can be given. Common prescription medications include proton pump inhibitors, that is PPIs, acid receptor blockers, cimetidine, ranitidine, and antacids. These will usually be prescribed for 2 or 3 months and then re-evaluated. Then prokinetic agents. If something is slowing or impairing the motility, the process of moving food through digestive system, prokinetic agents can actually help. These drugs can help and encourage the stomach to empty the food into the small intestine without holding into it for too long, and they reduce the tendency to send food or fluids back up through the esophagus. Low-dose antidepressants. Some people whose symptoms seem to be related to the nervous system benefit from a category of medicines known as tricyclic antidepressants. These medicines, given in much lower doses than they are given to treat depression, may help to subdue the perception of the pain and discomfort as well as modulate psychological triggers. Some also help the stomach relax during digestion, allowing it to expand more to accommodate the food. But functional dyspepsia is often more complicated than that, and medications overall only have a moderate success rate in treating functional dyspepsia. Some other therapies that people use to manage their symptoms, which include behavioral therapy, relaxation techniques, biofeedback, and psychotherapy, may all contribute to a more regulated nervous system and digestive system than dietary changes. While diet alone isn't a major factor in the functional dyspepsia, everyone can get benefit from paying attention to which foods seem to trigger the symptoms and avoiding those foods particularly. This can be a very individual kind of the thing. You might want to consider keeping a food journal or diary to track how your body responds to different kind of the meals, or try elimination diet to systematically test different categories of the foods. Eating smaller meals and chewing more thoroughly can actually help. Lifestyle changes. Some people find that losing weight, getting more exercises, getting adequate sleep, and reducing stress factors in their lives actually improve their digestive symptoms. So this is the good information regarding functional GI dyspepsia. If anyone is having such symptoms, then kindly you can modulate the symptoms by certain lifestyle and dietary interventions, and if not even getting benefit from them, then one can seek the medical advice from their physicians. Thanks for watching this video.